Well, greetings from Calvin University in Grand Rapids, Michigan. My name is John Witvliet from the Worship Institute at Calvin, and it's my delight today to be in conversation with Ed Phillips, Candler School of Theology, Emory University in Atlanta, and with Kent Annan and Jamie Aten from Wheaton College, Wheaton, Illinois. Welcome to all of you.
Good to see you, John.
Great to be with you.
Each of these colleagues has done amazing work in supporting congregations during COVID-19 with specific advice related to worship practices. And so first off in our conversation, I'm wondering if you each could briefly describe the strategies and resources that you've developed. Ed, could we start with you?
Sure. My name, Ed Phillips is my name. I teach at Candler School of Theology. Back in April, it became clear to me and a few of my colleagues that we were entering a new phase in the quarantine situation in which governors were beginning to say that they were going to reopen states for business. And it occurred to several of us that this would have implications on churches. And as different local bishops and judicatories and congregations were trying to figure out how to do this safely, we thought it would be really excellent to put together a consultation of persons from the public health field, from the medical profession. I live in Atlanta, Georgia, which is very close to the CDC, Centers for Disease Control and Prevention, as well as some theological leaders and ecclesial leaders, church leaders in the churches, and just to see what would happen if we got everyone together to talk about this from different levels of expertise, different areas of expertise, including pastors who deal with situations on the ground. And the idea was to get together all of these voices to do a consultation in which we would approach the issue with the best public health information we could gather, as well as theological assessment of the situation. So there were concerns that churches had about how to do certain kinds of things appropriately according to their own traditions. And so this began to be conceived as an ecumenical consultation, the Ecumenical Consultation on Protocols for Worship, Fellowship, and Sacrament. And we put an insane schedule together to put out a formal guidance document, which came out in June, early June, June the 8th, precisely. And then we followed that up a month later, almost a month later, with the Spanish translation of that guidance, because there was a paucity of useful information for Spanish-speaking congregations as well. So that document now is available through our website, and they're going to be posting that information. So that's really what we did, first of all, was to try to help churches with guidance on how to do worship in sacrament in this new environment.
Very good. Thanks, Ed. We've been deeply appreciative of that, and also for the good work happening at Wheaton through the Humanitarian and Disaster Institute. And Jamie, I'm wondering if you could describe some of the resources you've developed.
Sure, we'd be glad to share some. One of the ways that we've gone about approaching our work has been to try to create resources that are both biblically based and research based. And so grateful for Ed and his team and the great work that they've done, and just the amazing ways that they were able to offer some just great guidance, especially on liturgy and ways to really, approach worship in such a practical way. So Ed, thank you again for all the incredible work you all are doing. And so for the Institute, one of the first things that we did back at the end of February, being aware of some of these things that were likely coming our way with COVID, we actually started writing a number of articles. Actually, it was the first series or collection of articles in the US specifically developed to help guide the church through times of COVID and what might be ahead. And then we released our very first manual on preparing your church for COVID-19 on the same day that it was declared a global pandemic on 3/11. And that particular manual has now been translated in about 6 different languages, and then has also been adapted for a number of different denominations as well to the unique particulars of their worship. And then over the course of the last 6 months, we actually just put out a report that I'll be sure to pass along to you, John, so that we can share it. But it has information about the 118 resources that we've developed since the launch of COVID, including our Spiritual First Aid Hub website and our Reopening the Church website that we've done with the National Association of Evangelicals. And as part of that collaboration, we've also been holding an ongoing webinar and a number of town halls. And I've also ended up holding a couple of major online summits that have been attended by around 16,000 people altogether. So I'll hand it over to my colleague Kent now to see if he has anything else to add.
Yes, thanks, John. And as Jamie said, so appreciate the work you and your team did, Ed, to help us. We loved seeing that resource and shared it as well. I think Jamie did a good summary there, and part of what we're doing is working out of experience that he and I have and other people on our team of working in disasters after hurricanes, after earthquake in Haiti, after tsunamis. And so we felt like we'll probably get into this more later in the conversation, but part of developing these resources was continuously sort of once a week asking, what's the church going to need next? And that led us to keep adapting, finding research, finding partners to develop these 118 resources. And as Jamie said, getting into lots of languages. And part of that work was how do we hustle to stay ahead of the church, to know the difficult decisions and actions that were coming at them quickly.
Yeah, that's good. Thanks. And next, I'd like to actually push a little bit into the values that really guide the work that each of you have done. I'm thinking there just have been hundreds of things provided by many different resource providers out there, but often working with very different sensibilities about how we can serve congregations well. So what are some of the values, some of the virtues that have been central in your own imagination as this material has been, organized and shared? And Ed, I'm wondering if I could start again with you.
So first of all, I just want to say that the work that Jamie and Kent are doing has just been extraordinary. And we've learned a lot from the materials that they were putting out in terms of how to make it accessible and theological and biblical. And really, this has really been a joint venture in some respects in terms of how we have partnered together to try to do the best job for the churches across the United States. Our number one value that we had is to try to be sympathetic to the real problems that pastors have locally. And central to our guidance is, to be theological in the sense of, thinking through these things, not just as a public health issue narrowly, if there's such a thing as a narrow public health issue, but to think about it from the standpoint of what does this say about the gospel? And so we've been very, very upfront with our Christian values in this. We heard from some leaders, for example, one leader in one of the churches was consulted and asked, what experts are you consulting as you're putting together your expertise? And he listed a number of public health individuals, experts, but not a single person that was a biblical scholar or a theologian, although I know that this person probably was drawing on that, but it was not giving really a witness to, we felt like, to the world that there are theological and Christian concerns that were central here. It's not just simply public health. So that's central to us, but also second, and I think a related value is the value of no judgment. That is to say, at this time, as long as churches are operating with the degree of concern for the public good, different congregations, different denominations might reach different judgments about how to approach this that not everybody would agree with. And so our view was simply not to be judgmental about that. We're going to withhold any kind of evaluation of theological concerns, although we wanted to give a positive witness to what the consultation believed were core values for us. So it's like witness to what we believe, but withhold judgment about persons who might have different views and approaches.
Good, thank you. And I think especially around questions related to sacramental practice or practice of the Lord's Supper, has different names and different traditions, that they're tremendously different sensibilities and approaches that congregations are taking.
So Jamie and Kent live in the evangelical world, which, I mean, that's very broad, and but the ecumenical consultation primarily had in our sites congregations that were on the more sacramental liturgical end of the spectrum. I mean, we want to have conversations across the spectrum, but we knew that churches that have a central place for the Lord's Supper, for example, the Eucharist, or for certain kinds of practices of baptism, that there were specific concerns about practice that we felt like needed to be addressed in very practical ways, as well as theological ways. And so that really has been more of our center of focus of attention and guidance.
Yeah, thanks. And then how about you, Jamie, Kent, some of the values, virtues that you've been striving after in the work?
Well, in our process, we've really focused and been driven by 5 really guiding key principles in terms of virtues. So maybe I'll highlight those real quick. And then the other kind of guiding values that have helped us has been drawing from some of Kent's work on the slow kingdom coming practices. So Kent, what if I highlight the virtues and hand it over to you to highlight the slow kingdom practices?
Sounds great.
Great. So for us, we really try to start out with a place from the virtue of humility, recognizing that we all bring different perspectives, there's different challenges, different experiences, and also that we have our own biases that we're bringing into these conversations. So really trying to approach this conversation with a sense of humility and the resources that we've developed. And then another key virtue for us has been the virtue of love, to make sure that we're seeing our response not just about protecting ourselves, but this is one of the ways as Christians that we can truly love our neighbor, thinking about Mark 12:31, that, you know, that really can be a good guiding verse for us, or thinking about in Matthew about Christ's call for us to love our neighbors as ourselves. And then another one has been persistence or fortitude, which I think is become a more and more important virtue in the work that we're doing presently, that as the church has started to come to grips that this isn't something with COVID-19 that's just going to pass quickly, but is much more of an ongoing marathon, that sense of endurance is a really important perspective to have. And then also wisdom, that we want to make sure that we're bringing together the best theology and the best research and science available at the time to be able to make good, informed decisions. And then the last one is justice, that we recognize that within many of our communities, the issues that we're seeing that are causing additional problems, such as racism or looking at some of the disasters that are happening or climate change, that all of these things, those aren't new challenges, but have long existed, and that COVID's really just put a spotlight on it. So we're always thinking and asking ourselves, how can the resources we're developing and the church in particular to care for the most vulnerable?
Good, thanks. And then Kent.
Yeah, that's great. That's great, Jamie. Those really helped to guide us. And then I wrote a book a few years ago called Slow Kingdom Coming, and it's practices for doing justice and loving mercy and walking humbly in the world. So these practices weave into the work that we do and the virtues that Jamie just talked about. So the first one is attention, which is, you know, what are we called to do, especially in the scramble? Like, what are my gifts? What am I called to do? How do we focus our attention? So that's helped to guide us. And then confession. What are, like, less in terms of sins and vulnerabilities as we do this work? What's our vulnerability? For us, it would be, okay, we're experts, for example, in disaster response, humanitarian work, but not in public health. And so we need to be aware of that vulnerability. And so, and there are ways to build around that. And then the vulnerability of, as Ed mentioned, kind of really knowing the on the ground decisions. If we're working on a team here, but like our vulnerability is, wait, are we listening really closely and paying attention to what pastors are facing week by week? So making sure that we do that. Third one, the practice of respect is, you know, how do we love our neighbor well? This goes into the virtue Jamie talked about. Like, this is about loving our neighbor. How do we listen deeply so we can love our neighbor well? And then a fourth practice of collaboration or partnering. And that, you know, we would almost every tool we would think, okay, who's a public health expert on this? Or we wanted to respond to the dual challenges of facing racial injustice in the midst of a pandemic. And so we turned to a colleague, Dr. Theon Hill, who's an African-American colleague who led the way on this project of developing a resource then, but we were able to provide support. And so that kind of collaboration, was a practice that we kept using over the last 7 months. And then lastly, a practice of truthing, which is, how do we make sure, I learned this of doing humanitarian work on the ground, having the best ideas, but make sure they're connecting with reality on the ground, sort of a term I borrowed from geology, but that practice. And so we would always be getting feedback on, okay, how's this connecting? Oh, that checklist was a little bit too complex. Next one, okay, let's do another draft where we simplify the checklist so it goes more. So I think those practices of attention, what do we call it, to confession, where are we vulnerable, respect, how do we love and listen deeply, partner, who do we partner with to do this work well, and then truthing to make sure the ideas and on the ground reality keep connecting, and then we keep cycling through those practices and are layered on top of those virtues that Jamie talked about.
Yeah, beautiful. It strikes me that all this work is an exercise in practical theology. Listening, speaking, drawing on deep theological resources in real time too.
John, can I add,
changing circumstances?
I want to add a couple of things that to the conversation that I'm sure Jamie and Kent will also agree with. One of the things that is central to our sort of approach to this is to talk about human bodies. That human bodies in fellowship is central to the gospel. I mean, we have deep in the Christian tradition is the theology of the incarnation of Jesus Christ. I mean, God did not send an idea. God sent a human person to have real fellowship with real human beings and continues to have fellowship with us. So this was a concern at this time of physical distancing. How do we maintain not just the connection that we can maintain virtually, but some sense of the real bodies, the physical touch. And that's really difficult right now. So we wanted to at least reflect on it and to acknowledge the difficulty of that, because that is not peripheral to the work of Jesus Christ in the world. That is central to the work of Jesus Christ in the world. And then another value is beauty. Our human need for maintaining beauty is grounded in our belief that God is beautiful and God's creation is beautiful as a result of being created by God. And in so much of the world now, there's a temptation for us simply to think that everything is kind of ugly and distance. And so we wanted also to at least to acknowledge our struggles with this. Not that we, came up with just a solution to the problem we're in right now, but at least to acknowledge that we have a longing for beauty, the beauty of music together, singing together, the beauty of being together in one place and seeing each other's faces. All of that now is really difficult. And so acknowledging this was important to our document, but also, to say, if we acknowledge that this is central, how do we maintain our longing for this even when we can't be together physically, so that we get accustomed not to experiencing these things?
Thank you. Yeah, absolutely. Of course, all of these materials that we're providing, they head toward congregations in this extremely politicized environment here in the United States, especially in 2020. And I'd love to ask what you're learning from how people have responded here. What responses have you become aware of in your continued listening? Which responses encourage you? Are there things that concern you about how congregations are responding to this material? And maybe here we could start with you at Wheaton, and we'll go to Ed. So I don't know, Jamie or Kent, on the nature of responses that you're picking up.
I can start with this one and go to you, Jamie. I think there's probably a little bit self-selecting. So the people we hear from are the people who are using the resources and curious and looking for sort of these sort of things. So I'm not sure we have a very broad sample of direct interaction, but we've been really encouraged. I think one of the things that's encouraged us is when churches take it and adapt it to their community, so they're using it. And one church said they had kind of multiracial gathering of pastors who were kind of going through the material together. We heard about different denominations in Indonesia, or in I think in Uganda it was being used. Like there were all dozens of countries, and so to hear these little glimpses, what that did in feedback was more encourage us to keep creating these, and mentioned with theirs as well, to keep finding ways to get them to new languages. So we had a Taiwanese student who went back to Taiwan while she was actually on a 2-week quarantine before so when the semester ended, she's one of our master's students. She went back, she was on quarantine, and one of the things she did was translate a couple of resources into Chinese, like for Taiwan and for China, and then to hear that they were there. So I think the feedback, we knew this going in because of this kind of work, and then as we were listening was, okay, we want to help with the kind of main evangelical denominations, with the other denominations who would use it. So like that's our core audience. But we always, and in our manuals and in our work, was who's going to be on the margins and who might not get this material. Right. And so almost we were listening, you know, to kind of turning your question slightly, John, listening for, okay, who might not get the best materials, or who are going to be the older people without, who aren't texting or Zoom, or who are going to be the refugee groups nearby who might not be getting much materials, or what countries and languages do we have connections where they could get to. So part of it was listening and good feedback loop. Okay, we're meeting a need. Okay, that helps us take a slightly different angle, but also, oh, who might not be, you know, the target audience for most people, and are there ways we can find to serve them?
You know, just to pick up on what Kent had just shared there, you know, one of the things that I think often we found a lot of encouragement in is by hearing the stories from other churches of recognizing that the church never closed. It was just our buildings that closed. Right. And so it was been really encouraging. You know, actually I had somebody the other day ask, like, what are some of the things that make you hopeful during this you know, time of COVID? And one of those things for me was being able to see the creative ways that the church has responded, and the way that the church is responding as the hands and feet of Christ during these difficult times. And just like as Kent was sharing too, I think it's also been beautiful to see really the full body of Christ operating in this time to respond to these challenges, and recognizing that as different individual congregations, that we all have different gifts, different, maybe slightly different callings or different resources, and that we don't have to do everything, but to really kind of pivot into what we've been called to do, and to do that well, that it's made it much more manageable, I think, for congregations. And then at the same time, you know, one of the things that we're not so much on our resources, but there have been a few things where Kent and I have done some writing to call out what we thought were injustices that we were seeing in the larger US culture that were actually causing harm to our neighbors. And the reception wasn't quite as warm and fuzzy to some of those. So I just mentioned that in that I think that even when we were approaching some of these issues from a non-political point, that there is this kind of energy right now in the US culture that is turning this from a public health issue into a political issue, which is just outright harmful.
Mm-hmm.
Yeah, absolutely. Ed, how about you? What are you learning?
Echo some of the same concerns. I mean, we have been pretty intentional so far of keeping our focus in the United States, because we don't, first of all, we don't have the expertise and the resources that Kent does to think about this on a global level. Situations on the ground in different parts of the world are different. And what might seem like good advice or good practical theology in a local situation in the United States might not work in another country which has different social practices, or even where the laws are different. So what we're attempting to do in phase 2 of our project is to work with different sort of global hubs through our various denominations that are part of the Ecumenical Project, to recreate the consultation on the ground locally, taking some of the work that we've done here in the United States, but not, you know, simply thinking it just can be taken, translated into another language, and boom, applied locally. It has to be adapted locally at the very least. So whether or not we'll be successful at that, I mean, this is a very, very complicated and difficult project. process of making sure that the consultation type of work is replicated in other parts of the world. But we're beginning to do this with our first work is going to be probably in Argentina, because we have some contacts there through the Methodist, not United Methodist, through a Methodist university in Argentina. So there's that. Yeah, Kent, it's just really amazing how loving one's neighbor has become a sort of partisan political concern, and how we live this out. Our approach, and I hear this is what your approach is too, is just to keep pulling back to Scripture, into the Bible. We might not all love our neighbor in the same way, but it's not proper for Christians ever to say, "Oh, love of neighbor doesn't apply here." It always applies, right? And so we just try to keep pulling people back to the core value of love, and love of neighbor as being a hallmark of the gospel of Jesus Christ. It's difficult at this time because, I've had conversations even with members of my own family who have different approaches about this and want to take it to a sort of partisan political concern. Our approach is simply not to engage with that debate. We keep saying, all right, whatever you say, this is a core value. Jesus said, love your neighbor as yourself. Love God, love your neighbor. That's non-negotiable part of the gospel. And so we keep calling back to that core value, and I see it as giving a witness to that.
Yeah, thanks.
And one thing, John, I love how Ed put that, and I think we've just see a similarity in approach of like we love God. So I saw in there like having prayer be this core thing. So knowing that, not being naive about the divisions, but being relentless in we love God, we love our neighbor. We think that science has a lot to offer. We did a webinar with BioLogos and others who do this, and that faith is not an enemy of science. That they're complementary in times like this of how to love our neighbors. So I think just knowing the divisions there, Jamie and I wrote some op-eds, we did some things to call someone out, but mostly just being relentless on loving God, loving neighbor. Science is really important in moments like these to love our neighbor.
Yeah. I think that we already have the title for this conversation, Relentless Love for God and Neighbor. Yeah, I'll sign up for that any day. It's terrific. And it strikes me that as I've been listening to you, that this could be a workshop really for anybody who seeks to serve congregations. And I think of the hundreds, if not thousands of people in denominational entities, parachurch ministries, other nonprofit organizations, publishers, and many, many others that seek to serve local congregational leaders. Yet it often strikes me how little we talk about the ethics of serving local congregational leaders, wise practices for serving local congregational leaders well. And I'd love to really ask in a very specific way, what advice would you offer, especially based on this work over the past several weeks, for how we serve local leaders well? So what are you learning? What advice would you pass along to someone who might feel called into that kind of work? Ed, could we start with you this time?
Yeah, sure. I would say call on Christians in various fields and deploy them. Which is to say, when this all sort of started, I felt that many of our churches were reluctant to put into service, to call into service different members of congregations who had areas of expertise and knowledge that could be applied. But my view of ministry is that, churches, may have a hierarchical sort of structure of bishop and pastor and various rules around ordination and who can do various kinds of roles. But really, all of us, by virtue of our baptism, are called into the ministry of Jesus Christ. And it's not as if our professional expertise or our professional life is not part of our discipleship as Christians. The group that formed the Ecumenical Consultation were sort of wanting to be deployed and we didn't feel like we were being deployed by our churches adequately. And so we simply said, well, you know, we feel this call to do this. And so we just went into service and formed the ecumenical consultation in order to give what we had to give that we felt like God was calling for us to do in this pandemic. You know, I, as a liturgical theologian, felt like my expertise was important as part of the conversation, but not the only important part of it. See, this is it. I wanted to be in conversation with pastors and with ecclesial leaders, bishops, and denominational headquarters, and with public health officials. So I might have a great idea about how things needed to be done theologically and biblically, but I needed to hear from them what their expertise could bring to the conversation. Something that Jamie Kent lifted up earlier was this virtue of humility. That is key here. Humility means to be teachable and to listen, but not to be, it's not a false humility of saying there are things that we do know that we should contribute to the conversation. And so I wanted to contribute what I thought I knew, but I wanted to be in conversation with people who could help teach me what I didn't know, so that together we could offer, perhaps some practical wisdom for how to engage. I will say, already in just the months that have passed by, we're learning more and more about how this disease operates. And so it's not as if the work is just done, in early summer and it's just done. Now we've done that, we can go on to the next project. We're continuing to learn not only the science, but also sort of like the social dynamics of how this is, unfolding in the United States. That's our area of focus. And so it's just really important also to continue to evolve guidance, because practical wisdom also means that we continue to listen and learn and to evolve.
Good. And then Kent and Jamie, how about you?
Okay, if Jamie stayed on mute, so I'll go for it. I think I really like how Ed talked about this. I feel like we've talked about a lot of the things that you're asking about, sort of leadership and serving this area. But I think of kind of 4 of humility, like I just said, and we've talked about before, and including knowing where you can contribute, collaboration, that we need to be collaborating really well, partnering, listening, so that we make sure we're connecting well. Part of listening, for example, is understanding, at the beginning there was sort of a hunger for information. Later on, there was sort of pastors can't keep up with the flow of information about this. So how do we adapt information through our listening to make sure we're serving well? And that's for us serving pastors, then for pastors serving their people. Then I think being practical, like helping to make these connections so they're actionable items. And I think when we do this, combined with everything else we've been talking about, that sort of helps we who are serving church leaders to serve them well, but and also similarly helps church leaders then move forward. And I think I'd add a 5th one too that we talked about in some of our resources is trust. So I think the key of trust, that each step of these ways, we know this in disaster work, humanitarian work, when people are feeling vulnerable. That's true in COVID as well. It's important to move quickly at times to help people, but that bond of trust is so important, especially with the swirl of information and misinformation. So I think for us and for pastors, one of the things we can serve really well is making sure we're being bridges of trust to get the right information to people in the midst of a storm.
Yeah, thanks.
Yeah, and just to pick up on what Kent was saying, and also Ed there, that I think it's also just as much about knowing what not to say as what to say. That one of the things that I've found concerning has been, so going back like how Ed had mentioned that, part of humility is knowing both what your weaknesses, but also your strengths are. And unfortunately, I've seen a lot of different, especially Christian influencers who sometimes I don't think are fully aware of where their weaknesses are or what they don't know about these issues, and are speaking into it in a way that, I also want to be talking about post-COVID. Like I want to be there, But I also know, from the science that that's going to take some time. And so I think one of the dangers is that we focus so much on what's going to happen next that many churches and church leaders are being neglected on how to lead in the now, in the present. And so really just encourage us that we make sure that we remain hopeful, but that we're also remaining realistic, because if we're providing a false narrative, we're going to cause our churches and lead them into harm's way.
Mm-hmm.
Oh, that's powerful.
I want to say one other concern that I have is this sort of need for what we've called in the consultation a kind of more federal approach. And that is to say, if we're leaving just like local leaders to make up their minds about what the rules, what the proper rules of deportment would be, and how to lead, that's a lot of expectations for pastors. Pastors will have to make judgments. Congregational leaders will have to make judgments. But there's some factual information that is not simply a matter of judgment. And so if those sorts of things, I think, need to be done a little bit more broadly, and on a federal level, that would be useful. It's also the case, however, that different parts of the United States might have different on-the-ground infection rates. And so I do think learning how to interpret that is really important information for pastors. But I live with a pastor. My wife is a pastor. And I know that one of her concerns is that how do I, in this glut of information that I'm getting from all these different places, how can I trust that, right? What I get from the internet, what I get from fellow pastors that share this with me, what I get on television, and then what I get from my ecclesial leaders. And when all of that begins to conflict, it's just really hard for local pastors. So I don't know a solution to this now, but I do think that why it's really important that Jamie and Kent and I are on the same side of this debate is that those who are giving this sort of thoughtful leadership to this now are not really debating the facts on the ground so much. And that's the message I want to give to pastors, is that some things are not simply open to interpretation or debate.
Yeah. And this is, fitting for us as we kind of move toward the conclusion of our conversation to talk about next steps and to name where we are in this journey, about 7 months into what surely will go for another 7 months and likely much longer than that. And so I'd love to ask, as you think about your work, what are the next steps for you in this conversation? And are there particular themes or guidance that you're eager to highlight right now as we talk together here in early October of 2020? Perhaps I could start with you, Jamie, or Kent from Wheaton, and then we'll go to Ed.
Well, Kent and I just recently wrote a piece for Religion News Service where we talked about how right now we're in what a lot of disaster or emergency managers would refer to as the disillusionment phase of the disaster. That, with disasters, it's not a perfect, phase-to-phase transition, but we do know from the research and from the work that we've done that there is some predictability about the types of periods or phases that people will go through. And, there was that kind of early on sense of hope of we're going to push through this. Everything's going to be back to normal soon. We're trying to come together as a country. But now you start to see the division, the ongoing mental health toll it's taking on people, the weight of this. And so one of the things that we've been focusing on since we're kind of shifting into that disillusionment phase at that 6-month mark was how do we start to recognize and lament the grief as a country that we're going through and the number of lives that have been lost. And how do we lament and prepare for knowing that there is a marathon ahead, that we're not just immediately going to be through this? And so what are the ways churches can help, continue to foster hope and endurance? And then I think a very practical thing that we've been focusing on a lot lately has been looking at spiritual and mental health issues within the church. So after, the same way that you might see in a natural disaster, that as people start to get further along, that those issues become much more pressing. And so we just released a 195-page handbook on COVID-19 mental health, recently. And then we also have some free online courses on spiritual care that people can take. And then also our spiritual first aid intervention and training manual that's all available for free on our Spiritual First Hub, spiritualfirstaidhub.com website. Kent, do you have anything else to add to that?
I think just to highlight this, all of what Jamie said, but this, as we go into this next stage of unknown, as you mentioned, John, I think this spiritual first aid resource is a really valuable tool for churches. Jamie led a team of researchers for about 15 years, and after 15 years of research comes out with this blessed method of how to really check in. It's so great for pastors, and then also for pastors to equip, so they don't become, sort of a bottleneck, but pastors to equip the lay people and other leaders in their church to check in with the needs in their congregation as we go through this disillusionment stage, as it keeps going out. So to check in on people's, it's an acronym for blessed, but belonging needs, livelihood needs, emotional needs, safety needs, and spiritual needs. But I just can't recommend this resource highly enough as something that's going to help churches who are already using it and pastors, but also really importantly, helping a pastor to equip a church to care for each other through what is ahead, as you're asking, which is all there, as Jamie said, at spiritualfirstaidhub.com.
Very good. And Ed, how about you?
Well, first of all, amen to that resource. It's extraordinary. And I think that it's not only a matter of pastors helping congregations learn how to cope with mental health issues. It's also the mental health of pastors who are frontline workers in this. I mean, like I said, I live with a pastor. I know how terrible it can be for them, but just the burden of trying to meet people's needs in this situation when you cannot be in the same room with people very often. And, my wife has had to do several funerals already, members of her congregation. And so that's real deep pastoral work, right? And even in the best of times, that can be draining on a pastor. But in these times, it's extremely difficult for pastors to learn how to maintain their own spiritual health and disciplines during this pandemic phase. So yeah, disillusionment. There's just a lot of that. It's lost its excitement phase, hasn't it? Of how we can marshal these initial resources. Zoom meetings, for example, are a wonderful gift that we've had this opportunity. But I'm on Zoom more than I want to be right now, and it's lost its allure. Our next phase, we're in phase 2 now of our work, is specifically focusing on Hispanic congregation, and the Day of the Dead celebrations are coming up soon at the end of this month. And while the CDC has a little bit of broad guidance about, sort of cultural practices, Halloween and Day of the Dead celebrations, we're going to be developing a resource. We're in the process of doing that over the next 10 days to give some guidance to congregations about things that can be done outside. This is something that Jamie's work and Kent's work has actually done much better than we have so far, and that is addressing the different, the way that certain things can be done outside more safely than they can be done inside. And that's just really practical. That's just really practical. And then also Las Posadas. I mean, that's coming up December. Congregations of all sorts will be facing Advent and Christmas celebrations, when we still are probably not going to be able to gather for our Christmas celebrations. And so that has a cultural aspect to it. I mean, the way the culture celebrates Christmas, but also it's a central part of congregations' year, to honor, commemorate the birth of Jesus. And it has various practices that go with it, such as Christmas caroling. And are there ways that congregations can do this, given what we know about the possibility of transmitting disease through aerosols, through singing and musical instruments? So that's really practical stuff. We're developing resources on that really quickly over the next few weeks.
Okay. Well, please know that all of us at the Calvin Institute of Christian Worship are very grateful for all of your efforts And I love how this conversation itself has been an example of collaboration, mutual affirmation. We draw on different resources and speak to different parts of the church world, but there's no better way to do it than together. So thank you, Ed Phillips. Thank you, Kent Annan, and thank you, Jamie Aten. Grateful for your work, and we look forward to continuing conversations.
Thanks so much, John. I'm really grateful for your work, as you know.
Yes, thanks for your great work, John, and for hosting this conversation. Really enjoyed being with you.
Yeah, really appreciate being a part of this conversation today.